Back now recognized for 5 minutes, gentleman from Virginia, Mr. Griffith.
Thank you, Mr. Chairman. Now, speaking of Medicare Part D, no one was required by law or force of penalty to subscribe to that. Isn't that correct?
No, but we did auto-enroll Medicaid dual eligibles into Medicare Part D.
But it is a different animal than what we're dealing with now, because a lot of Americans are being told they can't have their insurance, so they're going to have to sign up through the exchanges. So I do appreciate that, but there is a difference. You know, one of the things that when you get a time to take a look at the report, and I think it's a symptom of the problems that this website has had, is that you were not included in the briefings on the report that has come to light in the last 24 hours. But when you get a chance to read that, one of the things you'll see is they thought there ought to be one person overseeing all the different parts. And listening to the vendors who previously testified before this committee, it looked like they were each building their own part, and then in the last month they had to squeeze it all together, and in the last 2 weeks things were changing. Another part of that report shows us that on a timeline, you really want to have you want to define your policy requirements prior to finishing the design and starting the build. Wouldn't you agree with that?
That is the logical thing to do.
It is the logical thing to do, but in reality we've heard testimony in this committee that they were changing policy. We know the big change on July the 2nd, when all of a sudden the employer mandate was allegedly delayed. The President signed an executive order. I'm not sure it has legal authority, but he did that. Delayed that employer mandate. Further, we know from testimony that there were changes being made as close to the launch as 2 weeks before. So based on that, it would be the logical conclusion that you're going to have significant problems, wouldn't it?
With the luxury of hindsight, I can see that there are contributors to the way the system performed when it was unveiled.
Well,
but that's not. You know, I need to focus on fixing this thing.
And I know that your focus is to fix it now, but also when you take a look at it, when you're still defining your policy requirements as late as 2 weeks prior to launch, it's very difficult to design and then to build and then to test a system and have it work, whether it's the security component or the performance component. It would be logical to do it in the proper order. When you do the illogical, you're liable to have problems. I know you would agree with that if you were free to answer honestly. And I would say to you that I also noticed that no one person was ever appointed to head this up while you were in charge of part of it, and you're in charge of making part of it work. It looks like there's at least 6 different representatives from different agencies that had a hand in overseeing what was going on, and no one had control over the others. Isn't that correct?
I think it was a governance committee that was formed.
A governance committee. And isn't that interesting? And sometimes when you're trying to launch a big project like this, though, you have to have one general in charge of the operation. Wouldn't that be logical?
I would say that for the technical pieces, you know, I was responsible for making sure that the technical pieces were organized.
And last month, this committee uncovered a September 27 memorandum indicating that healthcare.gov launched without a full security control assessment. Administrator Tavener had to attest that she was aware that the launch carried security risks. Can you tell us what those risks are specifically?
First of all, I think the incomplete testing, it was fully security tested through 3 rounds of testing, so that when Marilyn Tavener signed the authority to operate on September 27th, it had no high findings and had gone through the appropriate security tests.
So you didn't. So what she said was not accurate. That it had did not have a full security control assessment. She was mistaken when she testified in front of us.
I think there's a part of that that sentence that might be that needs clarification. I think what we were trying to say was that the security control assessment was not tested for a full entire system of which we were still, remember, we're still building financial management aspects of it. I think it was just an acknowledgement that the 100% of the system was not complete at that time.
Okay. And it's still not complete today, and the people of America want to know, what's the security going to be if it's not complete on January 1st?
The October 1st pieces that were necessary, such as ensuring security and privacy for those functions that I mentioned, were tested.
And I appreciate that, but what can we expect on January 1? I apologize. I yield back.
Thank you. And by the way, our prayers are with the family of State Senator Cray in Virginia, who is, I guess, in critical
If I might
condition right
take, since you bring it up, if I might take a moment of personal privilege, I do appreciate your prayers. Cree and I were in opposite parties, but just like on this committee, you form friendships, and he served with me in that Virginia House of Delegates before he went on to the Senate and then went on to run for other office. But he's still a sitting senator, and it obviously has shaken everybody in Virginia, and he is a good man, and our prayers are with him, and I encourage everybody to say a prayer for Senator Deeds and his family.
I thank the gentleman. Now to turn Mr.